Hi, my name is Radia Swal. I am a member of the Bloomers Group. I will be presenting Learning Outcome 3 and will be pointing out important information which my team members have researched and presented in their own learning outcomes. It is important to develop relationships in health and social care sector, to maintain good collaborative working, to gain outstanding services. The importance of these relationships are that it improves collaboration itself. Having positive relationships with co-workers and other professionals will gain individual motivation to perform the best of their own abilities. Collaboration will also result in greater communication, which will lead the individuals to understand more clearly on what their specific tasks are. Collaboration will also improve efficiency. Developing professional relationships will improve the understanding of others you are working with, and it will help improve their own efficiency and productivity, and also will ameliorate their job related skills. Collaboration will also lead to transfer and upgrade skills and knowledge. Having both more experienced and less experienced staff in a team will result in delivering great long-term services. Collaboration and positive relationships can lead to transfer skills within the team. So if a new team member feels unwelcome or undervalued, this may cause them to miss opportunities to boost their confidence in their career. Also, it will ease the intake of a new team member. So if a team has already built their strong, positive professional relationship, it will have the ability to make new team members feel more welcome and make things more uncomplicated for them to integrate. New members will also be given time to observe the experienced members, which will lead them to adapt more easily and feeling more confident. It is important to get to know all team members, and this will build trust and give the opportunity to open questions. To develop collaborative relationships in health and social care sector, we need to be able to apply theories to relations, to communication, motivation and teamwork. There are different types of communication theories, and they all allow an effective structure to create and evaluate team members' contributions to the team's development and success. Motivation within healthcare professionals working as a team is essential for providing quality care for the service users. Communication when collaborating play important role in the social health and social care sector. All members that work together need to remember that miscommunication will lead the patient and the healthcare setting to suffer consequences. I have expanded and explored the points raised in the introduction of the aims of collaborative working, which are bringing professionals together to work as a team, is where each member of the team should have the same purpose, which is caring and working for patients. Also, the aims is to be able to solve and make critical decisions. This will allow professionals to share and discuss information to make sure that all benefits, outcomes of different options, possible harms and treatments are all understood. Also, the aim is to improve the members' knowledge and awareness. Observing other team members, especially who are more experienced and knowledgeable, will challenge people in the team to understand their own strengths and weaknesses And this will give the opportunity to learn and practice to go further and beyond their capability levels. The aims of collaboration is also to decrease the rates of morbidity and mortality, because ongoing good collaboration is a key strategy for healthcare sector to ameliorate, and it has shown improvement in the outcomes for decreasing the numbers. Also, preventing drug reactions and medication errors. It is important that all professionals that work closely with patients need to work also closely with the pharmacist on a daily basis, because collaborating with the pharmacist will prevent any kind of medication errors and reactions also. Having good relationships with team members is very important, but there may be barriers that come along which may affect the level of good collaboration in the team. You may need to work towards overcoming the barriers, even if it occurs as a team or individually. A barrier example could be ineffective leadership. Having strong leaders and guidance will improve collaboration, and consistent encouragement for collaboration. Also, offering opportunities to more teamwork and supporting the team members to develop new skills could help overcome this barrier. Also, goal confusion. That's a barrier, and it's very common because if it's not agreed and understood by each member, the objectives of the team, then goal confusion will always be there. But setting up a protocol for goals and get the members to analyze them, also outlining the workflow in every meeting, could also help overcome this barrier. Lack of trust is also very common, but putting team building exercises in place to give team members the opportunity to trust each other and creating more opportunities for collaborative working as groups could be a step to build trust. Also, diversity, building the team up with colleagues that have different levels of experience and having a wide range of diversity in a team, it will bring different varieties of perspectives, mindsets and skills for higher rated success that appeals to a variety of people. Different to barriers, there are also conflicts that are possible to rise in a teamwork. To manage a conflict, we first of all need to understand the conflict and explore alternatives to agree. Find a quiet and neutral location where you can discuss the conflict is like a first step. Conflicts should always be improved considering the impacts it would have on the service users. There are different types of theories and approaches to conflict management. The main motives of management is to minimize the conflicts and promote positive aspects of the disagreements. Theories of conflict management include the competition theory, which aims to find a solution for one party. The collaboration theory aims to find a solution that benefits all parties involved, and the compromising theory aims to find a middle ground between the conflicting parties. The Care Act 2014 helps to improve people's independence and well-being. Everyone's needs for care and support are different, and needs can be met in many different ways. There are many different legal frameworks that are set out under the Care Act 2014, which has been identified for room for improvement in services. Some of these frameworks are safeguarding, advocacy, changing the needs of service users, managing resources, financial and standards of care, and there's many more. All these have been identified for improvement in services because they are essential to provide high quality care. It will enable the professionals to use good collaborative relationships to improve patients' safety and reduce inequality. The King's Fund is an independent charitable organisation to improve healthcare in England. They have many case studies that shows how effective and important it is to have good professional relationships in collaborative working. An example is the Imperial Child Health General Hub's case study. The King's Fund worked with paediatricians, consultants from St Mary's Hospital to provide care for approximately 4,000 children, and many organisations came together to collaborate in order to maintain outstanding care. The Clinical Commissioning Group and the Acute Trust have worked together on a number of information giving campaigns to educate parents about appropriate use of the accident and emergency department. A big project like this is an example of good practice and professional collaborative working. This project has used highly motivated consultants at St Mary's, which drove forward the development of the hubs after years of relationship building with GPs in the local area. A child's commissioner was played a very important role in the initial development of this service. Staff at the Clinical Commissioning Group took the lead in spreading the model across their locality. A Clinical Commissioning Group also had an effective role in the project, managing the hubs, organising multidisciplinary team meetings and education sessions. All these professionals that got together, they used every positive aspect to build and collaborate to have a very successful outcome. In conclusion to my learning outcome 3, collaborative working underlines the facts about how important professional relationships are in health and social care sector. Meeting the aims of collaborative working will bring all professionals together to be able to solve and make critical decisions, which will lead to improve team members' knowledge and awareness. Having good professional relationships with team members and maintaining good collaborative working will gain outstanding services within the health and social care sector. Thank you.